and stimulants and psychogenic drugs. These are all coming under these classes. Substances means drugs and alcoholics and inhalers. All are there in this family. So as per DSM criteria, for every condition, there are some symptoms to be identified before diagnosing this person is having this type of condition. All psychological professionals, they have to follow DSM criteria for any diagnosis. So here, what is abusing? What is the drug dependence? So these are the conditions we have to discuss initially. The substance-inducing disorders include intoxication, withdrawals, and various mental state conditions. For example, continuously, regularly alcohol abusing people will lead to dementia. And this particularly, some drugs will cause psychosis also. And some drugs will cause mood disorders also. So these are all the effects people are getting because of drug abusing and dependence. So drug dependence is usually an addiction. A person psychologically dependent on drug means, he is dependent on drug means, one example I will say you, initially the person has taken, suppose, 250 ml of the drug, alcohol. Initially it gives some elation or euphoria for that person because of consuming some quantity of drug or alcohol. If the person is continuously consuming same quantity of drug, the effect what he is getting after some days, he will not feel. He need more quantity of drug or alcohol. That means body adjusted for the drug. To get the initial effect, the euphoria, the elation or happiness, he has to consume more drug. That means to increase his happiness, the euphoria, he is dependent on consuming more quantity of drug. That is called drug dependence. When he consume more drug only or more alcohol only, the initial happiness will happen to him. The small quantity drug what he consumed in the beginning, what it given the happiness is not coming now with the same quantity of drug. Now he has to increase the quantity of taking alcohol or drug to get the same symptoms. That is called drug dependence or substance dependence or alcohol dependence. So for this substance dependence, DSM has given some criteria. Those criteria you can read in your textbook also. All the things are available. So now we will discuss about alcohol use disorders. Alcohol means, see, we are having lot of alcohol varieties, 5% alcohol content to 50% alcohol content, or even in some cases, the more percentage of alcohol also there. So this alcohol, what it will do, alcohol is a depressant actually. When a person takes alcohol, what happens? Initially, it will create some stimulation initially. But continuously consuming alcohol will make the person depressive conditions. Initial feeling is very well-being, and the low feeling will reduce. They become more like outgoing people initially. Initially taking, feeling a well-being feeling it will create. And the low feelings it will reduce. And they become very like outgoing people initially. But if they continue consumption of alcohol, you are all seeing the person loses its control and his motor condition, motor coordination will get impairment, speech will get impairment, and reaction time also, the person reaction time also will reduce. We are all seeing all these conditions in society, the people, those who are regularly consuming alcohol. Finally, he reduces, he loses his ability to make judgments. Even the person regularly consuming, their vision also somewhat become blur. So these are all effects people are having, but even though they are consuming because of various causes they are having. So the causes are the work tensions, people are undergoing stress, or some other financial problems. To come out from those problems, people are addicting to consuming alcohol. Only those things will give temporary relief. But in long term, they are losing a lot of their functioning conditions. And next. Are you following, sir? Are you clear?
Yes, sir. Yes, sir.
Okay. Here, there are some types of drugs are there. Drugs or substances or alcoholics. See, some drugs will make you very calm. Some drugs will stimulate the person conditions. Some drugs will relieve the pain. Some drugs will create hallucinations. So there are different types of, different varieties of drugs. So first we will discuss in this which drugs are creating sedation. So here sedative drugs are there, hypnotic drugs are there, and anxiolytic. Almost all are same meaning, but these drugs will make the person calm. The person is feeling more stress conditions or some pain, is not getting relaxing. So for relaxing, what they are taking, the sedatives they are taking. Or the person is feeling more anxiety. So he is going to use depressants only. That means sedatives, what they will do, they will calm the person. When the person become calm, he sleeps. So this sedative, anxiolytic substances will create the person calm, and it will induce sleep, and anxiety also will reduce. For that purpose, some people are consuming this type of drugs. Normally, these drugs include barbiturates and benzodiazepines. These two types of drugs are available in the market to make the people calm, to induce the sleep, and to reduce the anxiety. So these are all will be called calming drugs. That means sedative. And next, stimulants. So in this group, in the stimulant group, see, we are all many people are regularly taking coffee. And some people are consuming chocolates. Some people are taking soft drinks. So these are all, even some people taking cigarettes. See, ultimately, these are all things: coffee, chocolate, soft drinks, and cigarettes. So what these are doing, opposite to that sedative things. Sedative things are reducing. They are calming. But here stimulants are encouraging the person. Indirectly, they are stimulating the person. Even in day-to-day life also, we are seeing some people, they are dependent on coffee. If they don't take coffee within some hours, they feel very something they are losing. They are not having enough energy to work further. So they need immediately some type of stimulant. So one of that stimulant is caffeine. Caffeine is available in coffee and chocolates and soft drinks and cigarettes. So these are all coming under stimulation conditions. Clear?
Yes, sir.
Depressants and stimulants, both types are available in drugs, in dependent materials. Both are there. So in addition to this, we are having opiates. The opiates word has come from, because these are coming from some natural things only. These are all opiates are some natural things. So these are not made in labs. These are all natural things. What these opiates will do, they relieve pain. See, person is feeling some pain, sleeping is very difficult. So they inject, they inhale this opiates to relieve their pain, and they will get sleep also. And once they consume these opiates, those things will induce euphoria, drowsiness, and their breathing also will come down because of this. Sometimes what will happen, high doses of consuming this type of opiates will create some breathing, respiration, that means breathing issues, and people may die also. So limited consumption is somewhat people are doing. If they consume too much means it leads to respiration problems. Unnecessarily other complications also will develop. Suppose if they consume opiate, the effect will be continuing. Suppose if they stop, people who cease or reduce their opiate intake, they begin to experience some type of symptoms again after stopping some 10 to 12 hours after. So what they will do? Again, they take opiates. So it becomes a dependence. Finally, people are becoming dependent on depressants, stimulants, and opiates. But all are having problem in many ways. The next type of drugs is hallucinogens. See, in schizophrenia disorder also, we discussed about hallucinations. Hallucinations, what we thought there, particularly when the person feeling hallucinations, his sensory problems will get more effect. So here also, if the person consumes hallucinogens, they change. The hallucinations will change the person's perception. His perception about the world, even sound and feelings, taste, most of the things will get distorted. Sometimes it happens very dramatic changes. So here also some examples I will give you. Marijuana, that means ganja antar kada mana vallu, ganja, ganjai, and LSD. These two are the main examples for hallucinogens. If the people consume ganja and LSD, definitely they will have these hallucinogens. Hallucinogens means their perception will alter. We discussed earlier also, if the thing is not there, he perceive there is something. And the blurriness also will come in the sight. Sometimes people looks two people. One person will look two people. So this is also a problematic thing, hallucinogens. So we discussed depressants, stimulants, opiates, and hallucinogens. All are almost drug family only. And some other drugs are there. Other than these four classes, some other drugs, inhalants, just by inhaling through nose. Earlier, what we discussed, all the drugs are, most of the drugs are consuming. Here, these drugs are inhaling. So, inhaling drugs also there. Generally, some examples I will give inhaling drugs means, and the paint, particularly the paint, and hairspray. In the paint, what they mix the thinner, gasoline, these types, if the people put on the kerchief, if they inhale the smell continuously, it will also create some problems. So these are all inhalers. So why, so far we discussed what is drug abuse, substance, dependence, and withdrawal. And I will explain about the withdrawal symptoms. Some people will stop suddenly taking drugs because of some social pressures or family pressures or some other reasons. If they stop suddenly, they produce a lot of symptoms in their physical, psychological. They will have a lot of disturbance. I will give one recent example also. In our Telangana state, KCR sir has once upon a time stopped this toddy suddenly, various some reasons during, particularly in Corona period, I think so. But in Telangana area, many elders, even females, are consuming this toddy. That is not real toddy. It is artificially made, actually, chemically made. So what happened because of unavailability of toddy, our government also stopped due to unnecessarily corona spreading that time. But the regular consumers, the toddy consumers, have serious psychological conditions. Their body is feeling so much painful. They don't have a control. They are getting tremors. and their behavior has changed very abnormally. Some people have become so angry. So these are all the conditions developed because of sudden stopping. So this type of conditions developing is called withdrawal symptoms. So any doubts so far what we discussed? Somebody please respond.
No, sir.
Clear, sir.
Okay, very good. Thank you. So varieties of drugs we discussed, and now we are going to discuss about causes of substance related. Why these type of substances? What are the etiology? What causes people are becoming addicted? People are suffering because of withdrawal symptoms. What are the causes? There are different causes. One is biological dimension is there. Biological means genetical. People will become addicted is largely a function of individual's biology, and genes work to affect addiction. Even we are also seeing in some families, generations, they are continuing drinking. Not all generations, not all the families, some families. So genetically and biologically, they are predisposed. They will get immediate attention to that. Their biological condition will make them to lead to this habit. And the second condition is neurobiological influences. See, neurobiological means in our brain, there are some places in our brain which are prone to more pleasure immediately. So the neurological conditions in the brain, particularly, that means we call it as a reward center. See, when we do some act, there is some reward is available means we will try to do once again same thing. See, neurologically in our brain, there are some reward centers are there. The people, those who are consuming these type of alcohols or drugs, the brain will reward them, create some very good happiness. So that type of neurological conditions also will cause the people to take again and again. One is genetical condition. Another is in the brain, the pleasurable, the reward centers because of this consumption of drugs. So it will make the people to consume again and again. Ultimately, it makes dependence. And another condition, another cause why people are consuming drugs and alcoholics. Psychological conditions. Almost psychological condition also related to neurological condition. So almost both are same. So psychologically, people are having some reinforcement. Positively, when the people consume drugs, positive reinforcement. That means they are feeling some happy. They are reducing the pain. They are getting good sleep. They are reducing anxiety. So these are all psychologically the person is feeling somewhat improved conditions. That is the reason people are consuming drugs or alcohol. And some negative reinforcements also there. See, negative. See, person is having some problems, unpleasantness in the life. How to escape from all these things? So many people say, I have some problem, that is the reason I am consuming alcohol. So the negative things to reduce, to create the pleasantness, to escape from the negative symptoms, negative feelings, some people are consuming drugs and alcohol. And social dimensions. Socially, see, there is a friend circle is there. Somebody is there in friend circle. He was habituated with consumption of alcohol or drugs. Nowadays, we are all seeing in youth this dimension particularly. Initially, even they are socially, the teenagers or early adulthood, they're reluctant to take these drugs or alcohols. Social pressures will make them to consume. Friends, particularly friend circle, and even media also nowadays, lot of encouragement they are doing. In TV and all, we are seeing lot of advertisements. Cigarette consuming is a style. So media also indirectly encouraging, and friends and socially, people are getting habituated to this drug habits. And cultural dimensions. There are culturally causes also there. In some cultures particularly, taking alcohol, taking drinks is not a, they don't look it is a big mistake culturally. Whether you accept or not, in our Telangana, in many areas, when people go to work, the laborers, after completion of their work, every laborer will get one toddy bottle. Culturally, it is acceptable there. They don't look like some big mistake. In some cultures, taking alcohol is a big mistake. So culturally encouraging, some cultures are encouraging, it is not a big mistake. Even in many families, if some relatives comes, they are offering alcohol. They are supplying non-vegetarian food with alcohol. It has become a prestige for the family. It is a respect for others we are giving. So these are all coming under cultural dimensions. So the causes depends, biological cause genetically, a neurobiological cause is because of that reward centers in the brain, and psychological dimensions. People are feeling psychologically very happy, pleasurable. That is the reason people are taking. And negative reinforcements to reduce their painful symptoms or escaping from the problems, some people are consuming. And socially, social dimensions means friend circle, media, all are encouraging to consume this type of drugs. And culturally also, we discussed already, some cultures are accepting. It is very respect in some cultures taking alcohol and drinks and all. So far we discussed types of this abusing dependence and causes for the drug abuse, causes for the dependence. Now, we are going to discuss about in this same topic, treatment for substance related problems or disorders. See, in Hyderabad also, there are number of de-addiction centers. It has become a big business nowadays. So in addiction centers, people are getting admitted, particularly the highly dependent people. The families are getting suffered. Even the person also individually also suffering financially, socially, and is economically and work-wise also is suffering. after a lot of suffering, the person is showing interest or family members forcing him to join in a drug addiction center. They are going and admitting in drug addiction centers as a inpatient. So normally in hospitals, inpatient means once their problem gets solved means they will be discharged. Here also, in drug addiction centers, they will keep the person as inpatient months together, a minimum 3 months. I have visited some drug addiction centers also. I have seen some conditions are very painful by seeing all these things. So in drug addiction centers particularly, they also use different types of things. First thing they will do, psychoeducation. Psychoeducation means what is drugs? By consuming drugs, what will happen? What are the drawbacks a person is getting because of drug consumption? How their family is getting affected, children are getting, how they are socially getting stigma, all these things. They will give some psychoeducation about the drugs particularly. And after that, they will give some treatment. See, if we like sweets, regularly we eat sweets. If we like chicken, most of the people will eat 3-4 times a week. Same people, the people who joined in drug addiction centers, they like, that is the reason they are consuming. But here they admitted for the need of, they want to avoid. That is the reason they joined. So here in drug addiction centers, the people, what they will do, aversive treatments, one of the treatment they will give. Aversive means creating opposite action, reducing cravings, creating some aversion about that particular alcohol or drug. So this type of treatment they will apply. This is one of the treatment I am saying, not totally. Here, what they will do, disulfiram, one chemical is there, disulfiram. Hello? See, in aversive treatment, they use disulfiram. What they will do, in the drink, they will ask him to drink. But without their knowledge, the person knowledge, they will mix this disulfiram in the drink. Earlier, the person, when he is drinking, he is feeling very happy, euphoria, and he is getting a lot of relievement, all these things. But once this in aversive treatment, by mixing some disulfiram or some other thing, the person will not get happy moments. He will get some nausea, headache, body pains, some irritation. Whenever he consumes, he will get this type of feeling. Earlier, he likes very much. Now in drug addiction centers, once he started consuming this type of thing, he will not feel happy. So one day he will get aversion. Why I should take this drug? Unnecessarily I am getting so much unhappy and problems. So it is better to avoid. I don't like taking this type of alcohol. So this type of feeling they create, this will be called aversive treatment. And one other is psychological treatment. Psychological treatment means they will give some therapies, particularly. Psychological therapies. After giving some psychoeducation, keeping them as inpatients, and psychologically, treatment means to bring some change in their thought. So psychological therapies will help the persons, and those type of interventions create self-realization. How it is spoiling my career, how it is creating problem in my family, with my children. All these type of realizations, self-realizations through psychological interventions, the self-understanding will develop how I am getting spoiling because of all these things. So through psychological interventions in de-addiction centers also, with the help of psychotherapies, they will bring the change. They will create some change. But not for not all the people, definitely here the prognosis in de-addiction centers also, the persons who are coming out from de-addiction centers, 100% they will not drink, they will not get addicted again. Not sure. There is a improvement, 30-40% people only, not 100%. Because for that also some various reasons are there. Again, relapse problems. And the third treatment, particularly even doctors, even in psychological therapy also, earlier he is using drugs or alcohol uncontrolledly. There is no control. Whenever he wants, he can take. Now, in psychological counseling, or actually in counseling centers, particularly de-addiction centers, MD psychiatrists are available. Psychiatry doctors are available. So initially they will advise controlled use of alcohol. Controlled use. Earlier, he is using unlimited, 500 ml, one day 400 ml, whatever he likes, he is using. But they will make him to follow some discipline for some period to reduce the withdrawal symptoms, because suddenly stopping will create withdrawals. So they will advise him, take the drug, take the alcohol in controlled manner. That means with limited quantity. So that type of procedure, they will continue for more days. After this limited quantity, that means controlled use, and one day they will ask him, or they will create the self-understanding to abstinence. That means totally stopping consuming of this alcohol. Slowly, gradually, they will create self-understanding. Like, see, until unless the person accepts his problem, creating some self-understanding, then only he will totally stop alcohol taking or drugs taking. So gradually it will happen. But aversion is a different thing, creating aversion about that drug, about that alcohol. So these are all the procedures in drug addiction centers. They are all having now following. And here one more problem is there, relapse. Relapse means the old earlier habit, again he is making. After coming out from the drug addiction center also, I told you 100% people will not have this prevention. Some people will get again taking alcohol and other things, lot of things. So there is a chance of relapse. So why it is happening, relapse? So those conditions also, when discharging the patient, the counselors will explain to the family members also. Because earlier the person is taking alcohol or drinks because of social conditions, cultural conditions, all things are there, no? So the person, after getting discharged from this addiction centers, again is going into the same family, again going into the same culture, same social conditions, same friends. So there are more chances again, it becomes relapse. So that is the reason here counseling will affect a lot. Counseling will give very good improvement to avoid the relapse. Okay. And preventive steps also there. Preventive steps who has to take? Generally, government is taking a lot of preventive and promotion, both. So now we are discussing about prevention steps. We are all seeing in news agencies and the newspapers and television channels. Government is identifying some drugs someplace. They are catching, they are booking cases, they are putting in jails, they are giving punishments. So only this type of activities from government side, they are implementing to prevent certain things. And in schools and colleges also, particularly in schools, educating the children about the drugs and what the harms it is creating. See, ultimately, we can achieve anything by educating the people, creating awareness about the damage, what they are going to have because of consumption. So this type of education in school level itself, as a preventive measure, we can invite. So we briefly, I am not saying elaborately, we briefly discussed about drug addictions, substance abusing and dependence and withdrawal and the types of disorders and the causing factors for becoming this drug dependence and the treatment things also we discussed. And finally, how to prevent this also, we had some discussion in this topic. So now the time for any interaction from students. Please.
No, sir.
Okay.
Sir, as a psychologically, how we can actually control this kind of people at home? Like, is there any small tips like by using this?
See, psychological counseling is a part of de-addiction center only.
Okay.
They will give some aversion definitely there. And education also they will do regularly. See, there is a group class is there in drug addiction centers. They will conduct group classes. And they will give some counseling type also there. And some aversion things also they implement there. And freely the drug or alcohol is not available in the place where they are staying. Slowly, it will not happen immediately because that is the reason they are keeping the persons for 3 months, 4 months. So finally, after coming out or during as an inpatient in drug addiction center also, psychological counseling, therapies they will provide. See, in therapy, what it will happen, we will make the person to understand about the consequences and what are the remedial steps he can follow to come out from this problem. That type of self-awareness, the psychological therapy will create. See, therapist, when person comes to a therapist, he will sit with him for 1 hour. But one day, he has to become on his own like a therapist. So what skills he require to avoid this type of problems? So all these skills, all these awarenesses will get benefited him to avoid to a certain extent.
Thank you, sir.
Okay.
Sir?
So,
Sir,
in this,
1 second. Sir, how can you identify a person, like if in a family they have a drug addict, like what are the behavioral changes? మనం ఎలా అబ్జర్వ్ చేస్తారు అంటే how can you identify it as addicted to drugs and all? అతను ఇంట్లో డ్రగ్స్ తీసుకుని ఉండకపోవచ్చు, but once he goes out, he might behave differently. So what are the things we have to look into?
so how to identify a person who is taking drugs now? You are asking.
Yeah, yes. That too, like if he's very normal at home, but once he gets outside, he might take the drugs. So how can we identify what changes we can identify in him? Like,
Okay, see, the alcohol is different and the drugs are different. Okay. Drugs means particularly this LSD, cocaine. So these type of drugs will have long-lasting effect.
Okay.
And if they consume a drug, it will have some withdrawal symptoms. It will create some, if they don't take that particular drug again and again, by observing the person, he feels very much irritation, he becomes anger, and his behavior activities also will change a lot. But normally these drug takers, they will try to hide the things from the family.
Yeah, that's what, sir. Like, how can we identify? That's what I'm asking. Actually.
Only by seeing the behavior symptoms, because family members are regularly observing him now. Earlier, how he is behaving, now how he is behaving, that symptoms definitely he will get some doubt. And another thing, if you want to get in-depth awareness about all these things, in your textbook, there is a DSM criteria for every disorder is there.
Okay, sir.
You follow the criteria of the disorder. See, so many disorders we discussed so far. For every disorder, to decide, to observe what are the symptoms we can see in a person, DSM has given in your textbook very clearly.
Yes,
okay,
sir.
Ma?
Yes, sir.
So anyhow, you have to read for your examination purpose also. So to know very well, you please go through it, because in this short period of time, for all the conditions, we cannot discuss about the criteria.
Okay, sir. Thank you.
And next, we can go for next topic with your permission.
Yes, sir.
Yes, sir.
Okay. So in this unit, actually, another two topics are there. One is personality disorders is there, and sexual dysfunctions and disorders are there. There are two topics left in this unit again. And after these two topics also, again, there are 4 topics. We have only 3 classes. So that is the reason, because of short of time also, I am not going totally elaborate. If we go total elaboration, we can't complete even another 2 topics. So I request all the students, go through your textbook. It is having very valuable content in your textbook. Go and have a deep knowledge about the even substance abuse disorders and its criteria, how to decide all these things. And the next topic we are going is personality disorders. So personality is very important for everybody, but many people wrongly think about personality means the appearance and size. It is totally wrong. So what is first personality? Let us think. Personality means how the person is thinking. how the person feeling in certain situations, how the person behaving in certain areas. That means relating to self and relating to others also comes under personality, not the size and appearance. This personality is very dynamic. Personality dynamic means it is not constant for anybody. It will change. The person, how he is behaving 2 years before, today he may not behave in same way. There may be some change. His attitude has changed. So we are talking about personality is not constant factor. It is changing continuously. So personality is a dynamic. Dynamic means it is changing continuously. So we discussed about personality. And what is personality disorder? Everybody is having some personality. How disorders are coming to persons? Personality disorders are a group of mental disorders. These personality disorders involve a long-term patterns of thoughts and behaviors that are different from what is considered normal in our culture. See, in our society, in our culture, there are some acceptable behaviors, acceptable thoughts. If the behavior is different from what is considered a normal in a culture, if the behavior is different means, so he is having some problem. Normally people will judge like that. There is something wrong with him. His personality is different. So this type of behaviors will cause serious problems in relationship also, in work, in social activities also. So that is the reason, because these personality problems creating problems, so we are calling them as personality disorders. So in our textbook also, there are some types of personality disorders. There are 10 types of personality disorders. Suppose when we are reading these personality disorder symptoms, we also feel, we are all having this type of problems. That means we are also having some personality problem. Not like that. When anything exceeds certain level, then only it will become a problem. So don't think by reading the textbook, we are also having this type of sign and symptom. That is the reason we are also having some personality disorder. Please don't assume yourself until unless some professional has confirmed you are having this type of personality problems. 1 or 2 symptoms is not a problem. So these 10 types of personality disorders grouped into 3 different categories, because all the personality disorders are not having almost the overlapping symptoms or related symptoms. Different symptoms are there. That is the reason they made into 3 categories. So these categories will be called as clusters. Cluster means some group of symptoms. So why they made a cluster means, suppose in cluster A, there are 3 types of personality disorders. So in that cluster, the symptoms are overlapping from one personality to other personality. That is the reason they made clusters. Otherwise, they have to make 10 personality disorders as 10 independent personality disorders, but they made some identical characteristics and symptoms. They made into groups, that is called clusters. So let us discuss about cluster A personality disorders. So this cluster A personality disorder person, how he behaves. This cluster A personality disorder involves unusual and odd thoughts and behaviors. That means unusual, his behavior looks very unusual. Everybody accepted means that is usual behavior. It is a social norm. It won't have any problem. But the behavior is unusual. And his thoughts are somewhat odd thoughts, abnormal thoughts. And behaviors also not normal. So this type of behavior will come under this cluster A. So in cluster A, there are 3 types of personality disorders. One is paranoid personality disorder. Second one is schizoid personality disorder. Third one is schizotypal personality disorder. So paranoid personality disorder means the person is have more paranoia. Paranoia means they don't trust others. They have extreme fear about we should not trust everybody. So some people are having this type of problems. So I request everybody to mute their mics. So paranoid personality disorder, the person will have more suspicious nature and he don't have much trust on others. So this type of persons we are seeing in our society day-to-day activities also. So this is called paranoid symptom. And next one is in cluster A, the next one is schizoid personality disorder. This is very important chapter. Mostly this type of questions will come in your examination also. Schizoid personality disorder in which a person prefers to be alone. He is not interested in having relationships with others. Most of the time, this person will be alone. Socially, he is not so active. Whenever there is a very serious, urgent or necessity, then only he will try to interact with others. And he is not much interested also to have relations with everybody. And the third condition, schizotypal personality disorder. Here, these are all the similar conditions. The paranoid person, what he will do? He will avoid mixing with everybody. He avoid a lot of group activities also because it's paranoidism. And schizotypal also is most of the time alone. Why? He may have that condition of paranoidism also. Why unnecessarily mingling with others? So schizotypal personality disorder in which a person has unusual thoughts and ways of behaving and speaking. They are uncomfortable having close relations with others. Same condition you see. They are very uncomfortable having close relations with others. That means they are also most of the time isolate. And their thoughts are very unusual. And their behavior and talking also somewhat not usual. So these 3 condition personality disorders kept in cluster A, personality disorders. That means cluster A. Okay. And next, coming to cluster B. For this also, DSM has created criteria. See, for every disorder in DSM, the criteria we have to follow to decide the person is having this type of problems. That means diagnosis depends only on DSM criteria. Just because of one symptom, we cannot decide. So cluster B personality disorders involve dramatic and emotional thoughts. These people behave very dramatically. And emotional thoughts they will have, and behaviors that can keep changing. It is not constant, going on changing. Here the first one is antisocial personality disorder. The second one, borderline personality disorder. The third one, histrionic personality disorder. Fourth one in cluster B is narcissistic personality disorders. So here there are 4. In the first cluster A, there are only 3: paranoid, schizoid, schizotypal. Here, antisocial, borderline, histrionic, and narcissistic. 4 personality disorders are there. In your textbook, they given very detailedly the conditions about the personality disorders. So let us discuss briefly about one by one. Antisocial personality disorder, person how they will have, in which a person has a long-term pattern of manipulations, making real things, making unreal things in discussions, lot of areas, and they try to exploit the people. The other people weaknesses, these people will make it a cash. And violating the rights of others. They don't bother about others' rights. How the other person is having suffering because of our behavior, they don't bother. They will simply violate the other person's rights. They don't allow other person even talking. Antisocial. The behaviors, what they are exhibiting, society cannot accept all these things. Manipulation, any society will accept. Recent elections, we are all talking manipulation. Some people are blaming. EVMs are manipulated. Some people are agreeing, some people are not accepting. That means it is a problem, na? Manipulation. For understanding only, I utilized that EVMs example. Don't mistake me. And exploiting. Exploiting other people in wrong way. Their weaknesses, exploiting and making personal gains. The person is making personal gains by exploiting others and violating the rights of others. So this type of conditions comes under antisocial personality disorder. Next, borderline personality disorder. Here, this person will have a lot of troubles managing their emotions. See, happiness is an emotion, sad is an emotion. So when the person is sad or when the person is so happy, they are unable to regulate. Even person gets angry on somebody, too much anger he will show. That means for a small reason, he will show extreme anger. That is not required. That means he don't know how to regulate his anger. Anger is also emotion, no? That means he having trouble in regulating the emotions. And these people will have impulsive. Impulsive means sudden bursting. Impulsive means taking decisions without any thinking, proper thinking. They think sometimes we are very cool people. Sometimes they think we are very angry people. So the consistent is not there in their emotions and behaviors. So this inconsistency will create lot of trouble in their relationship, no? Even in the house also, wife and husband relation, the person is having suppose borderline personality disorder. If his behavior is not constant, his emotions are not constant, unnecessarily showing very excessive emotions, definitely the other person will have a lot of problems with that person. The inconsistent behaviors will create a lot of problems in relations. Generally, when we are going to meet somebody to get some approval, before entering into his cabin, we will ask, how is the sir mood today? Joking, I am saying, just some people are asking like this because he is not having constant emotions. He don't know how to behave. He don't know how he will react. So that type of people comes in borderline personality disorder. And next, histrionic personality disorder. Histrionic personality disorder, this person always expect attention from others. Attention. They are attention seekers. They expect everybody discuss about me only, about my greatness, about my great qualities. So they are seeking attention from others most of the time. If the people, other people giving good attention on him, they have very strong happy emotion. So the histrionic personality disorder having this attention seekers. We are also looking in day-to-day life, no? Some attention seekers. And next, narcissistic personality. These people don't have empathy. And they don't show any empathy with others. And they expect admiration from others. Okay. They think that they are better than others. And they expect we are all having, I am having, I deserve for special treatment. When I go to some office, I expect some special treatment. I am eligible. I got that eligibility, deservedness. Everybody has to respect me. When I enter into office, everybody has to stand up. They say, Namaste, sir. Yes, sir. They think we are all great people. Everybody respect me. And they don't have empathy. That means other people difficulties, they don't care. Only for themselves admiration, themselves happiness, satisfaction. Everybody respect me. This type of behavior is called narcissism. So now by listening all these symptoms, so in day-to-day life also we are seeing this type of people around us. Definitely we are seeing. But with one symptom, we cannot decide this person is having this histrionic personality or borderline personality. We have to follow to decide the DSM criteria for any decision, any diagnosis of personality disorders. And cluster C, personality disorders related to anxiety-related conditions in the person. And fearful thoughts, behaviors. The cluster C people will have anxious thoughts, fearful thoughts, and fearful behaviors. So these overlapping conditions people are having will come under cluster C personality disorders. So here in cluster C personality disorder, the one is avoidant personality disorder. And the second one is dependent. They are more dependent on others. They don't take any own decisions. And the third one and the last one is obsessive compulsive personality disorder. That means OCD personality disorder. So avoidant means these people are very shy. They feel very shyness. They think we don't have good qualities. Other people will identify us is very inferior, very shy person. So this type of symptoms a person is having means they will avoid many group situations, group gatherings. They don't go into groups. Even in on the dais also, they don't go for any debate or talking. Some people also there, avoidant, shy people, more shy people. Even 10 times if you call, 10 times if you ask, then only they will respond. They will avoid. And dependent. Some people will depend too much on others. Even though he is having that capability, for small things also, they depend on others. For buying a ticket also, they will ask how to buy a ticket, how to go to Charminar, for small things. They are dependent most of the time. They don't take much responsibility for their actions. Because they are afraid. Why they are dependent means they are afraid about the consequences. If they take a decision, what consequence will happen tomorrow? So instead of facing the consequences, better to take somebody's opinion. Na? That means better to depend on somebody na, for taking decisions. So this type of people comes under dependent personality. And next, obsessive compulsive personality disorder. These people, more perfectionist. They want everything in order. Everything should happen as per the program written. In computer, will work as per program written. But person, how he behaves like a programmer. Sometimes we have to change. Na? If they are thinking one order, if the order misses, they get so much anxiety. They feel we have lost control. So this type of perfectionism, without having flexibility, they face in day-to-day life so much problems. But this personality disorder is not like OCD. There are some difference between OCD and this personality disorder. Some conditions are overlapping, but there is some difference. We should not think both are same at any cost. So personality disorders, what causes? These are all the conditions causing. Normally, these personality disorders begin in their childhood or even teenage. And how they grown up in a family and how they adjusted in their family from their childhood and how they got, some people will get abused also in their family. It becomes as a trait for them. It becomes as an order for them. Even over discipline from childhood also, it makes them too much perfectionism. So this type of things, even some genetically also some people are having, or some trauma, what they have had in a early life trauma also will play a bigger role to create this type of personality disorders. How to diagnose personality disorders? See, there is a test, IPDE, one test everybody is following in India, International Personality Disorders Examination. There is a test available, personality disorder test. So by conducting this test also, we can come to understand which type of personality this person is having, or observing some person's symptoms and his experiences and his family history also. By doing all these examinations, taking clear picture from the family and the person, how he is behaving in different situations. So the therapist will come to some understanding this person is having this type of personality. If we know the symptoms of each personality, definitely by observing others, we can guess, we can gauge this person is having this type of personality. And next, how these personality disorders will be addressed or treated. Normally, personality disorders, first initial stage is identifying what type of personality this person is. So what type of disorders he is having. So after doing all this identification, all these things, psychotherapy only we use for changing the disorders in personality. And certain medications also there, because particularly some mood swings and anxiety conditions in personality, particularly anxiety and mood swings. Those conditions are very serious, means even psychiatry medicines also people will use to reduce some anxiety. Because we discussed about anxiety disorders is dependent personality disorder and obsessive personality disorders. So these conditions coming under anxiety conditions. And mood swings, particularly borderline personality disorders. So the conditions are very severe, means as a therapist, as a psychologist, we can guide the person to have some consultation with psychiatry and take some medication. Okay, today we have concluded substance abuses and personality disorders. Now there is a time for another 7-8 minutes. If you have any doubts, please ask me.
Sir, I have one doubt here. Coming to this cluster B personality, like dominate and this kind of emotions, right? If managers or CEO is having, how we can actually escape or manage our position? Like, suppose if you take any one of this, right? I'm very closely connected to this actually for cluster B.
Cluster B.
Yeah, manipulation, no emotions, and also is very attention seeker and also no empathy. It's all I can see in one of the person, like the profile. How we can actually escape from that? At least few tips. It is not actually somebody is coming to treatment, and how we can actually survive in a higher position.
Normally, here one big thing is there, sir. The personality disorder people, they don't accept their personality. First condition, they don't accept. And they don't come for any therapy also immediately. Because the surrounding people having lot of suffering and family members are having lot of suffer, on their insistence only, on their pressure only, they will come for therapies. The basic condition here is they don't know we are having some disorder. Even they know also, they don't agree we are having this type of condition. They think this is correct. What I am behaving is correct. Clear, sir? Now, yeah, you suppose in your surrounding somebody is there, ask them to take the advice of some professional psychologist. It is better, sir. Only that much only you can do.
Okay. Okay.
Just without observing the person, giving small tips is also not correct, sir.
Yeah. No, the person is in a CEO position. Like we have to survive in that particular area. How to escape from them?
See, sometimes because unless the opposite person is not agreeing, reciprocity also will become a difficult.
Yeah. For exam point of view, we have to give clinical description, next to diagnostic criteria, causes, treatment, and everything, no?
All these things you have to write. Because in your textbook, everything is available, Amma.
Yes, sir. Because of that only, for
Yes,
A, B, C clusters, everything is there. We have to cover all these.
Yes, yes.
Okay, sir.
Because
Okay.
if the question comes in personality disorders, it comes as a long question only. The
Yes,
15
sir.
marks question only it will come.
Mm.
Even drug abuse also or sexual disorders also. These questions in this particularly unit will come as a long answer questions. There is a chance like that.
Yes, sir. That's why I have been asking.
Okay. Anything, any more? Tomorrow class we will have sexual dysfunctioning disorders.
Excuse me, sir. Before confirming personality disorders, according to DSM, if all points should be present, sir, or some points means 5, 6 or there. If two is
Okay, right question. In DSM criteria, they given the criteria. These are all the symptoms, but out of these symptoms, this much he should have. Okay, out of 9 symptoms, suppose the person is having 5 symptoms, means we can confirm he is having this personality disorder. Like that in criteria, they mentioned very clearly. Not in your textbook, they may not have mentioned, but in DSM, if you have a DSM manual, you can see all these things.
Okay, sir.
Excuse me. Thank you very much. We are closing. Now it is 3 o'clock. Next faculty also have to give time, na?
Sir, one small doubt, sir.
Please.
Sir, is there a probability that from 2 or all the 3 clusters, there will be symptoms in a person, sir? Like only from a one cluster, the symptoms will be predictably seen.
See, one example I will say you. We are all humans. We are having some suspicion about others.
Yes, sir.
See, up to certain level, it is okay, acceptable. See, that is the reason in the initially also I told you, if you read these personality disorders, first we will get suspicion. Most of the conditions we are also having, that means we are a personality disorder affected person. Please don't think like that. If it becomes trouble to others, family members, colleagues, then only you have to bother about all these things. Then only you have to go to a professional for the advice.
Sir, my doubt is whether from different clusters also symptoms may be seen in a single person.
No much chance.
Okay, sir. That's what I wanted.
No much chance.
Okay, sir. Thank you.
Okay. Thank you very much. We are concluding today class. Thank you.
Thank you, sir. Thank you very much.
Thank you, sir.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you, sir.